Hi friends, I hope you all are fine. Among the women community, do you know which is the most dreadful disease which we are facing nowadays? It's none other than cancer, especially breast cancer. This October month is considered as a breast cancer awareness month. Being a part of medical fraternity, I just have a plan to share few information about breast cancer. According to statistics, every 1.7 minutes there is a breast cancer is being diagnosed. Also, every 11 minutes there is a death occurs due to breast cancer. Do you imagine what is the reason for that? Why there is an increased rate of breast cancer? Usually, women are not concerned about their health. They are always concerned about their family members, especially husband, family, children, parents, and so on. So they consider their health is the least important. And also most of the women, they are ashamed to consult any doctors because they are very ashamed to show their sensitive parts to others. So I think because of these reasons, there is increased rate of breast cancer nowadays. But do you know, breast cancer we can detect very early. If it is detected very early, the recovery rate and survival rate is 99%. The breast cancer screening should be start from ourselves. Woman should spend few minutes to examine her breast every month. So once we examine every month, then only we can identify the normal findings. Once she do it regularly, she can identify what is the abnormal findings in her breast. This self-breast examination has to start once the girl attain menarche, and it should be continue till her end. So because hormonal changes are happening every month. So once there is a female hormones influencing in her body, so there is a chances of getting changes in every month. So it is very important to check the self-breast examination in every month. So if she find any sort of abnormality, she can approach to the hospital. So in every hospital nowadays there is a separate unit for breast screening unit. So there will be one lady doctor and one lady staff nurse will be there. So she will be the responsible to screen you. So if you find any sort of abnormality, so you can approach them. So without wasting time, we can move on to today's topic. Breast cancer is the form of cancer which is developed in the cells of the breast. After skin cancer, breast cancer is the second most common cancer can be seen among the women. Breast cancer can be affect both men and women, but it is more common in female. Here I will explain different types of breast cancer. The first one is Angiosarcoma. The second one is Ductal carcinoma in situ. Next one is inflammatory breast cancer. Invasive lobular carcinoma. Lobular carcinoma in situ. Male breast cancers. Paget diseases of the breast. And the last one is recurrent breast cancer. So we will see one by one. First we will explain about the angiosarcoma of the skin. Angiosarcoma is a cancer that forms in the lining of the blood vessels and lymph vessels. It often affects the skin and may appear as a bruise-like lesions that grows over the time. Next one is inflammatory breast cancer. Inflammatory breast cancer often appears as an enlarged breast with red thickened skin. Next one will be the invasive lobular carcinoma. Invasive lobular carcinoma is a type of breast cancer that begins in the milk-producing lobules of the breast. Next will be the lobular carcinoma in situ. Lobular carcinoma in situ develops in a milk-producing gland, that means lobules, and does not spread in nearby breast tissue. Next will be the male breast cancer. So male breast cancer is a rare cancer that forms in the breast tissue of the men. Though breast cancer is most common thought of as a disease that affects women, breast cancers does occurs in men. Male breast cancer is most common in older men, though it can occur at any age. Next one will be the Paget disease. The Paget diseases of the breast occurs most often in women older than age 50. Breast and nipple changes can be seen as a sign of breast cancer here. Make an appointment with your doctor if you notice such kind of any unusual changes. Here I will explain about the causes of breast cancer. The exact cause of breast cancer is unknown. So we have other causes like hereditary, exposure of radiation, chemical exposure, obesity, and so on. Other than that, there are few risk factors also. So we will see one by one. The main risk factors are family history, age more than 45 years, late or early menopause, obesity, alcoholism, contraceptive pills, lack of breastfeeding to baby, high fat diet, late marriage, etc. The recent researches which shows there is a high rate of sleeplessness and stress which can lead to breast cancer nowadays. Now I will explain about the diagnostic measures of breast cancer. So which include history and physical examination, self breast examination, then clinical breast examination, mammogram, aspiration or biopsy, chest x-ray, MRI scan. These are the few diagnostic modality which we can screen breast cancer. Here we reach the various management of breast cancer. The various management of breast cancer which include surgical management, hormonal therapy, immunotherapy, radiation therapy, and chemotherapy. So first I will explain about the surgical management. The first surgical management is removing the breast cancer, that we called it as lumpectomy. During the lumpectomy, which may be referred to as breast conserving surgery or wide local excision, the surgeon removes the tumor and a small margin of surrounding healthy tissue. A lumpectomy may be recommended for removing smaller tumors. Some people with larger tumors may undergo chemotherapy before surgery to shrink a tumor and make it possible to remove completely with a lumpectomy procedure. Next surgical management is mastectomy. Removing the entire breast is called mastectomy. A mastectomy is an operation to remove all of your breast tissue. Most mastectomy procedures remove all of the breast tissue including the lobules, duct, fatty tissue and some skin including the nipple and areola. Removing a limited number of lymph node is called sentinel node biopsy. When it comes to the chemotherapy, chemotherapy is a widely used treatment for cancer. The term chemotherapy refers to the drugs that prevent cancer cells from dividing and growing. It does this by killing the dividing cells. Example like vincristine and methotrexate. So these two drugs are widely used in chemotherapy. So here the radiation therapy. So radiation therapy uses high energy radiation to target cancer cell. Radiation therapy may be used in the treatment of leukemia that has spread to the brain, or it may be used to target the spleen or other area where leukemia cells have accumulated. So here it comes the hormonal therapy. Hormone therapy can be used before or after surgery or other treatments to decrease the chances of your cancer returning. If the cancer has already spread, hormone therapy may shrink and control it, especially estrogen and progesterone for breast cancer. Next is the immune therapy. Immune therapy uses your immune system to fight cancer. The body's disease-fighting immune system may not attack your cancer because the cancer cell produce protein that bind the immune system cells. Immunotherapy works by interfering with that process. Example like cytokinins and interleukins. Here we reach the end of our section. That is how we can prevent breast cancer. So when I explained in the risk factor, I said you there are two risk factors like modifiable and non-modifiable. So modified risk factors like lifestyle changes, food patterns, physical activity, these all things we can modify it. So other things like non-modifiable like hereditary, race, age, these all things we cannot do anything. So it is better to discuss more about the modifiable risk factors. The first and foremost preventive measures is regular screening and checkup. So the screening and checkup should start from ourselves, as I said in the beginning. So self-breast examination should be start once the girl attain the menarche. So she has to do it in every month. So nowadays there are awareness classes will be there in the school level itself. So from the school they are giving education how to do the self-breast examination. After 35 years, it is very important to go for a clinical breast examination if she find any abnormality in the self-breast examination. So after 40 years, it is must go for mammography every year. So if there is any abnormality in the mammography, they can go for detailed ultrasound and MRI scan, and also like a biopsy if it is indicated. When it comes to the physical activity, nowadays all are not interested to do any physical activity. This lack in the physical activity can lead to obesity. So when there is obesity, there is more fat tissues. So more fat tissues will produce more estrogen. So that can lead to breast cancer. When it comes to the food habit, we need to include fruits and vegetables. So all fruits and vegetables are blessed with the anti-cancerous property. So especially according to WHO, we need to include 5 fruits in our diet. These are apple, berries and cherries, peach and pomegranate. All vegetables are good sources of vitamins and minerals. Especially broccoli, cabbage and cauliflower has an anti-cancerous capacity. So we need to include more vitamin C diet in our food, especially orange and lemon. While cooking, we have to add garlic, turmeric and spices, which also has a capacity to fight against breast cancer. We have to stick on to physical activity in our daily life. So we need to do some kind of jogging, walking, yogas and some sort of relaxation techniques. So once we relieve our stress in all those ways, which will help to prevent getting breast cancer. Next will be the sleep duration. So sleep duration is very important. So daily we have to sleep 7 to 8 hours. As an adult we need to sleep 7 to 8 hours. So once we sleep or our circadian rhythm become normalized, then only our body and mind get a proper relaxation. So which helps to prevent breast cancer. So here we can wind up our today's section. So in this video I just explained about what you mean by breast cancer, different types, risk factors and its management. Last, I have a humble request to you all. Please watch it and share it maximum. After watching this, if anybody is ready to do the breast self-examination every month, or they are ready to go for a mammography or any clinical breast examination, that is the success of this video. So next class we will meet with another episode of midwifery topic. So take care. Bye bye.